So, I am going to talk to you a little bit about fitness and being active with nets, which is one of my favourite subjects. Fitness, anyway. So who am I? You obviously know me as Jo from Planet's Cancer Charity. I run the charity with Layla, do all the marketing bits, website, social media, etc., and I am, like Layla, a NET patient. I was diagnosed in 2011, age 34. First saw Neil then, and I had surgery, and I've had 2 lots of surgery since. Fairly big surgery, but I'm very lucky in that I've just had surgery so far. And I'm a work in progress like we all are. So my background is fitness. I've worked in fitness for 25 years, and I've got a degree in exercise and health science. And so when I left my other job, my day job, at the end of last year to come over to Planet's full-time, I did my level 3 GP referral and my level 4 cancer rehab because I'm very passionate about fitness and I'm very passionate about how it's helped me with my cancer journey, and I'm really keen to share that with other patients as well. So I've brought my 2 passions together, which is Planet's and the fitness, and hopefully I can help lots of patients in the future. I also teach lots of classes, so I teach a class most days, body pump, body balance, grit, and I do CrossFit. So I'm a CrossFit athlete, which is what we call ourselves, because it's essentially competitive fitness. So that's me. So there's lots of benefits of physical activity generally, as we're all aware, but there's also lots of benefits that are specific to your cancer situation. So as an overview, improved energy levels, and then I will expand on all of this in a second, reduced anxiety and improved mood, contributing to your own well-being, increased confidence, it's hopefully a positive aspect to your day, overall improvement in quality of life, social interaction, improved general fitness and other health conditions, fewer complications, shorter stay in hospital post-surgery, better tolerance to treatment, and lower chance of recurrence shown in some studies. So these studies don't really relate to neuroendocrine cancer. I think it's more difficult to get stats on cancers like ours, where there are less people, but there are lots of studies, particularly to do with colorectal and breast cancer, which has shown there is a lower chance of recurrence if you exercise. So to expand on all of those things, first of all, improved energy levels. So this is probably a little bit of an unpopular thing to say to someone sometimes. Improving your cardiovascular fitness and your strength in turn improves your energy levels. So I'm sure a lot of us have felt at times that we are suffering from fatigue or just general tiredness, and the last thing you want to do is exercise. But actually, I'm standing in the wrong place now, actually if you do exercise, you will then see that you have got better energy levels. Starting your day with exercise, again, you may not feel like that. You should find that your energy levels are better during the day. So if you are suffering from fatigue, and that is an ongoing thing, and I don't necessarily mean treatment fatigue, so I don't mean if you've been in hospital and you feel terrible that you should still be really pushing yourself to get to the gym. I just mean general fatigue. Improving your fitness and moving can help that. And there's lots of different ways you can do that. That doesn't have to be, a HIIT session or going for a run or anything like that. It can be something as simple as going for a walk. Reduced anxiety and improved mood. I'm sure I'm not alone in suffering from anxiety and, to a certain extent, depression, dealing with cancer, living with cancer, and knowing that there's no end to that situation is not easy. And exercise is shown to reduce anxiety and depression. It is a natural antidepressant, so if you can do some kind of exercise, you may find that helps. Contributing to your own well-being. So being diagnosed with cancer is something that can make you feel very out of control, and there is something very positive about contributing to your own well-being and taking some control. So exercise could be seen as part of your treatment. So where possible, you could approach your surgery, which you have to have. Again, it's not something that you're choosing to have, but you could approach it by doing some exercise and raising your fitness levels, and maybe see that as a positive way to move forwards towards your surgery, with a view to recovering better, maybe spending less time in hospital, and potentially, if you can improve your fitness, you could start again. So the way I see it is keeping myself fit is not a miracle cure, and it's not going to help, it's not going to avoid me having these treatments, but it is a way for me to place myself in the best position to have more treatment. So I would like to think that at no point am I going to be told, well, you're not fit enough to have this treatment, so we can't do this. So Arjun actually mentioned in his speech earlier that your fitness is something that is considered when they're looking at your treatment options. So I can't change my situation. I was diagnosed when I was 34, that's not ideal, but I can help to improve my situation and make sure that I'm always going to be in a position to go forward with some treatment if it's an option for me. And that is an element of control, as far as I see it. Increased confidence, so there may be some physical changes that can affect your body confidence, self-esteem. Exercise can improve your confidence generally, but also it can help you trust your body again. So I know that when I've had surgery, I've gone home, I felt quite scared about leaving, especially the first time I had surgery. I felt quite scared about being discharged, and you know, every ache and pain that I had, you worry that that's something going wrong when actually it's maybe your body just healing. And I think getting back to exercise and feeling like I'm getting my fitness back gives me a little bit of confidence in my body and what it's capable of. When I'm putting myself through my paces, I think that makes me think, okay, I've got through that. My body's back to working pretty well, and that helps you trust your body again and get back to not worrying about every ache and pain and, you know, is this cold, is this something more, or is this just a normal, you know, normal illness that we're all going to sort of get in our life. So I think there's an element of confidence that I have got from getting back to exercise. Positive aspect to your day. So as patients, we deal with lots of negative things in our day, whether that's a blood test or an injection or treatment, and exercise is a pretty positive aspect to your day. It doesn't have to be going to the gym, it can be going for a walk. It can be doing a little bit of gardening, whatever. It's just bringing something positive and something good that you're doing to your body. Improved quality of life. Aside from the mental benefits, improving your fitness can help you to stay mobile, stay independent, and continue to enjoy your hobbies and time with your family and friends. So it's not just about getting fit. Obviously, the fitness side of things helps in the ways that I've already mentioned, but it's also about getting back to enjoying your life. So maybe you love gardening, for example. If you don't manage to get your fitness back post-surgery or post-treatment, then maybe that is going to be out of your reach. But if you can improve your fitness and get back to a little bit of sort of, you know, get your strength back, then you can get back to the things that you enjoy, and in turn start to feel like you're living your life again a little bit. And also get out about and enjoy time with your family and friends, so you're not excluded from things that you enjoy. And that leads on to social interaction. Exercise can be social, particularly in a group setting. And, you know, if you can get back to your social life to a certain extent, then it can reduce the burden on your carers, so helping to maintain healthy relationships. I'm single, so I don't have to worry about that because there's no one to look after me anyway. But if you are in a relationship where your partner is helping to look after you after some treatment, and you know that is part of living with cancer, unfortunately. If you can get your fitness back and get back to doing some of the things that you like and doing those things independently where possible, then that helps reduce the sort of, the carer-patient situation as well within your relationship, which is obviously healthy long term. Improve fitness and other health conditions. So obviously we're all talking about cancer today, and there are many benefits to doing exercise with regards to your cancer, but there are also many benefits generally to exercising. And as you get older, it is natural for us to develop other health conditions. The fitter you are, the less likely that is to happen. So other health conditions, like for example diabetes, that can complicate your treatment. So the fitter you, although as I said earlier, I'm not saying that fitness is any kind of miracle cure, it can help you avoid other issues which could possibly compromise your cancer treatment at a later date. So we just all want to try and keep as fit and well for as long as we can. I've also written on there, stave off frailty and disability. So again, as you get older, you naturally lose muscle mass and you naturally get less fit. So exercising counteracts that to a certain extent. I don't know about you, but when I've had surgery, I've gone home and I feel like I'm a shadow of myself. Before I go in, all your muscles disappear. There's a lot of muscle wastage. I don't know what the percentage is, but it is quite... Do we know what the percentage is of how much percentage of muscle you lose per day, every day you're in hospital? You shrink a little bit, and it's sometimes a little bit demoralising to get home and feel that you've got to get yourself back to where you were before. But if you can do that, then you're going to help yourself for the future, with regards to more treatments, but also just generally becoming more frail as you get older. And then that in turn leads to a lack of independence. So it's just yet another way to look at it. So aside from your cancer, we should all be keeping fit, strong, and flexible. So fewer complications. Patients with a better level of fitness are less likely to have complications after surgery and also spend less time in hospital. So we obviously all want to get home as quick as we can and avoid any complications. And I know that surgeons are much happier to operate on someone who they think has got a good level of fitness. Better tolerance to treatment. So being active is shown to improve how your treatment works and also reduce treatment side effects. So it might not be the same for everyone, but fitter patients tend to suffer less from things like nausea and tiredness when they're having treatment. And also there is evidence that suggests that your treatment can work better if you are fitter. I was listening to a podcast about that a couple of days ago, and one of the reasons is that a fitter person has a better vascular system or blood flow, and therefore it can help to get your treatment to the right place. And so particularly with something like chemotherapy, there is a lot of evidence to show that that can help that work. And lower chance of recurrence, and I said this earlier, there's not really any studies with regards to neck cancer with exercise, but there are lots of other cancer groups that have been looked at, and recurrence is lower in people that keep themselves fit. So, there's not really a downside to doing some exercise, and there's not really a downside to keeping yourself fit. So even if that wasn't the case with NET patients, you're going to gain all those other benefits that I've already mentioned. So these are just a few things that are quite personal to me, really. So when I exercise, I don't really feel like a cancer patient. There's a temporary reprieve, and my day always feels better once I've exercised. I feel quite lucky. I teach classes for a living, so I have no choice but to exercise. I've got to be there. There's people waiting for me. So even if I wake up and I don't really feel like it, I've got to go. So that is something that is just part of my life. And no matter how I feel when I get out of bed, if it's a bad day when my day starts, by the time I've exercised, I feel like I can cope with the day. It just feels better. And I feel more like me. And again, on this podcast I was listening to, they said, I mean, I have to plan my rest days because I struggle to not do something. But they were saying, for people that aren't so inclined to feel like exercising, that you should plan to exercise every day, and that probably won't happen, but maybe because you plan to do it every day, it might happen 3 or 4 times a week, and that's a pretty good way to look at it. I've had to reframe my goals, so what am I trying to achieve? Does it matter if I progress? And when I did my cancer rehab course, they talked quite a lot about progression, and I thought that was quite strange. I mean, I was the only cancer patient on the course, and I did ask lots of annoying questions, which were coming from a place of experience, which I think is quite useful for what I'm doing with other cancer patients. So does it matter if you progress? Not really. Does it matter? I mean, you get to a point in life where you're not necessarily going to get fitter and fitter and fitter because we're all getting older. And it certainly doesn't matter if you're progressing, if you're going through treatments. And as NET patients, we go through lots of treatments, so there's lots of ups and downs. But if you can try and get back to some sort of fitness after your treatment, then you're just back in a position where, okay, maybe you can deal with some other treatment further down the line. So I've gone back into the gym after, particularly my second surgery, where I just could not stop being sick, which is always a problem for me. And when I got back into the gym, I couldn't really do anything compared to what I did before. And I remember feeling quite demoralised that I have to keep picking myself up. And I'm sure we all feel like that. You have to keep picking yourself up. But what am I trying to achieve? I'm just trying to, it's not really about being at the top of the leaderboard at CrossFit. It's more just about getting my fitness back on track and getting back to living my life. And for me, it's a huge coping mechanism. It's not just about fitness. I love being fit. I like looking fit, all of those things. But really, it's a mental thing. I really do think it's an important coping mechanism for you. So even if it is just going for a walk or getting out in your garden for 20 minutes, I really think that the mental benefits are just as important as the physical. So reframe your goals, what you're trying to achieve. It doesn't matter if you're going to look a certain way or you're going to reach certain weights that you used to lift when you were 30 or whatever. You are just trying to keep moving and keep yourself in a position to go back to your doctors and say, yeah, you know, I'm looking after my fitness, and yes, I can cope with this next treatment. And again, I think I mentioned this earlier, but exercise gives me confidence in my body and what it's capable of, rather than worrying about all the things that are going wrong. So I certainly don't feel like I'm a cancer patient that's going downhill when I'm in the gym delivering my classes or whatever. It's a positive feeling. Small changes can make a big difference. So when I come out of when I come out of hospital, I'm certainly not thinking about going to the gym, but I am thinking about, can I do a 5-minute walk? And then the next day maybe I'll do a 10-minute walk, and then the next day a 15-minute walk. It's just these little tiny progressions, and that might be all you get to, and that's fine, but you're moving. And then I saw this quote. This isn't my quote, but I saw it and I quite liked it. Medical treatment saves lives. Exercise gives you your life back. So we can all go through the treatments, and you know, we can go back home and sit on the sofa, and yes, we're probably in a better position medically, but getting your life back, it might require you to do a little bit of something yourselves too. Exercise prescription. So again, this was something that I found quite strange on the course, was because they had like very specific exercise prescription lists that you should be going through, and there's 6, 12-week plans, etc., etc. But I just don't really think it's necessarily like that when you're going through treatment, because you have good days, you have bad days. We all start in different places. Some people are much younger, much older, fitter, less fit. A lot of us have other health issues going on. So it's difficult to write exercise guidelines, and it is really just something that you need to work with on an individual basis, but there is always something you can do, even if that's, I know like the Maggie's classes that they do, they're very gentle, and some of it is seated, and that's fine. It suits every person that goes in. Place of resistance training. So I think a lot of people associate going to the gym or exercising as going for a run or cycle or something cardiovascular, and the place of resistance training, for me, I think is quite important. As I mentioned earlier about when you have surgery and you're on, in bed a lot, you lose a lot of muscle mass. And we lose muscle mass as we get older anyway. So doing some kind of resistance training is quite important. And I don't mean Olympic lifting or, throwing dumbbells around, although you can do that if you like. I quite like it. It can be just body weight stuff like body weight squats, push-ups, but on your knees, just really gentle things. Or it can be using some water bottles as dumbbells. But resistance training, keeping yourself strong, it can help to improve your balance. It can reduce your risk of falls. It reduces fatigue, and it makes it easier to do your daily activities. And also, I think if you don't feel great, if you feel slightly nauseous or tired, for me, the thought of doing a little bit of resistance training rather than going out and doing some cardiovascular training is probably a little bit easier, and it's just as useful. As you get older, you lose your strength and you lose your flexibility, as I just said, and that can mean that you're in a position where if you fall over, you can't manage to get yourself up at a later date. So we all, aside from cancer, you need to try and keep yourself strong and flexible as possible, and just generally make life a little bit easier for yourself. And exercise doesn't have to mean the gym, which is why I put that picture. That is me and a friend doing the Isle of Wight 50-kilometre walk, which we did with all the CNSs. Did you do that one? No, you did the Jurassic one, didn't you? Yeah. So, walking, hiking, gardening, swimming, whatever it is, doesn't have to be the gym. Not everyone likes the gym. Actually, I don't go to the gym. I go to a CrossFit box. It's a different thing. A few case studies. So I've done a little bit of fitness with some patients, and there are some examples of how it's helped them. So the patient 1 year post-surgery, she was still having an extreme amount of pain, which no one could really explain. Unexplained coccyx pain, very low confidence, a lot of anxiety. And she'd spoken to her doctors about this coccyx pain. She was sitting on a rubber ring, and it was, causing her lots of problems. And within a few weeks of doing some exercise, the pain had gone. And she was a year post-surgery, so it wasn't necessarily just that it was, time from surgery. And that was probably because she was using some muscles, and probably because she was sitting down a little bit less, because she was doing a little bit more activity, and just generally moving and taking some pressure off, maybe some sort of nerves or whatever, by strengthening our tummy muscles and all the muscles around the area. But either way, the pain went, and we were quite pleased about that. It's increased her confidence, definitely less anxious, and obviously her fitness has improved. But it's like meeting a different person when I go to see her, and that process started from her doing a little bit of exercise with me. Patient 2 was post-chemo, pre-surgery, and very, very nervous about his surgery. And he thought that going to the gym was him having to do some running and cycling and things, which he didn't really fancy because he didn't feel that great after chemo. We just did a little bit of strength work, mostly body weight stuff, as I said before, and it gave him a bit of a focus before surgery. It improved his confidence. He felt like he had been prescribed this and that he needed to do it, and it just helped him think that he was doing something positive. He recovered quickly from surgery, and he felt that it gave him a positive attitude, and it made him feel less scared about approaching his surgery because he thought that he was doing something that was going to help him. And now he's doing the same, a little bit of the strength conditioning, the strength work rather that we suggested, because he's not actually a NET patient, but he's struggling. He's losing a lot of weight because of the surgery, and with losing weight rapidly, you do lose quite a lot of muscle, so that can help to counteract it a little bit, doing a bit of strength work. Patient 3 is in the room. Ongoing treatment, lots of surgeries, never really been into fitness. I have pestered for many, many years, and I think, when was it, about 6 months ago, maybe? She finally, gave in and did a little bit. And she loves it. So she tells me anyway. She's less tired, energised. We're talking about Layla, obviously. It's a shift of focus. It's a positive focus. It's making yourself feel like you are doing something to help yourself. And also, it has kick-started a healthy living, because quite often fitness is a bit of a cluster behaviour. So often when you start thinking about doing some exercise, you also start looking at other little things in your life as well. Less alcohol, maybe stopping smoking, maybe better diet. So sometimes she didn't smoke. But you know, it just gives you that kind of overall, if you're doing a bit of exercise, you don't then usually go home and think, oh, I'm going to have a cake now. It just gives you a little bit of focus. So exercise can help you to feel like you're not giving up on life and on your health. And that's how I feel. It is difficult. We're all in the same boat in this room. We've all been diagnosed with something that we'd rather not have been diagnosed with. And I think that it can help you feel like you're doing something to help yourself. So that is my final point. Thank you for listening.